All right. I think
Well, I
she's
see our participants rolling in to the webinar. So thank you for everyone who's joining us. We'll just give it a moment and go ahead and get started any minute now. Okay, so welcome to the Medicare webinar. I am Melissa Joy, and I am so pleased to be joined by Cameron Giardini. Today, we're going to talk about what you need to know about Medicare, both if you are a potential enrollee who's just turning 65 or is having a change in circumstances where you would become eligible for Medicare. And we'll also be talking about the special enrollment period that's happening now. And so it's important. First of all, I'm Melissa Joy. If you go to the next slide, Cameron, founder of Pearl Planning and a financial planner. And I'm joined by what I would refer to as our Medicare expert, Cameron Giardini, and he, as well as his team at Giardini Medicare, are a go-to resource for information on Medicare related topics. Cameron, thank you for joining us.
Yeah, thank you for having me. I'll take expert, I guess, for Medicare.
Yeah. Well, it's well deserved. If you go to the next slide, it's important for me to make sure that our regulatory disclosures are shared, and always love to go through those. And then additionally, if you go to the following slide, then we also have information on Giardini Medicare. And with that, we'll go ahead and get started. I'm going to hand it off to you, Cameron.
Yeah, thanks, Melissa. So I will highlight this. I know most people don't care about disclosures, but we actually get asked this pretty often. You know, how do we get paid? What is our role in the Medicare industry? So I don't work for the government in any way, shape, or form. I'm not Medicare, not Social Security, but we do help people transition to Medicare. That's really our specialty. So we are an independent insurance agency located in Southeast Michigan. We do work mostly virtually. So we work a lot over the phone, and we are compensated by the insurance companies directly. So if you use our services, we work with most of the major carriers you're going to find, Blue Cross, Priority, HAP, whoever it may be, and they compensate us directly via commission. It doesn't cost you anything to use our services. So I will at least highlight this. And we're all here today, or probably here today, because your mailbox or your inbox for email may look like this. So you're getting a ton of mail for Medicare, and you're just trying to figure out where to go for resources, what to do, and figure out really what matters for you. Do you want to go to a steak dinner? Do you want to call all these numbers? Or do you want to just go to a webinar or call somebody like ourselves where we can help you cut through all the noise and just figure out which plans might work for you going forward? And I will say, Melissa, she did highlight the fact that we're going to talk about the annual election period right now. That is October 15th until December 7th. So it's coming up very soon. This PowerPoint is it's more geared towards the transition to Medicare. So when we say transition, we mean turning 65 or retiring past age 65. But if you have specific questions coming up for the annual election period, then just please save those for the end, and I'll try to use more of the Q&A section for that, since, like I said, it's not really geared towards that for the presentation.
And I'll mention that we do have a Q&A section, so you can put your questions in there, and we'll also provide our contact details after the presentation. So you have a couple ways to get in touch with us or ask questions, and we will have a Q&A at the end.
Definitely. Yeah. And the Q&A is going to be, I would say, the most valuable. Truly, the PowerPoint's great. We're going to go through what you need to know for the basic level of knowledge for that transition to Medicare. But the Q&A is where you're going to get your specific questions answered. And speaking of answering questions, part of it is figuring out where to go, like I had said. So do you search it on Medicare.gov? Where do you go for resources? I know anyone on this webinar has kind of figured that out, that you got to go and do some other things to try to figure out what might work for your Medicare. And even Costco, we always bring this up. It's just kind of comical, the fact that if you look at this, I got to take myself off the screen here, but it basically says you need Medicare Part B right when you're turning 65, which, as we'll talk about in a little more detail, is not accurate. So just be careful where you're getting some of your resources and Medicare information. Oops, there we go. So again, we're going to talk about mostly that transition to Medicare. And we're going to cover everything that you see here. So what is Medicare? Do you need it? how do you get it? How much does it cost? And I won't read through all these because that's boring. But after this, it's really designed to take away most of the stress for that Medicare transition. So you can go relax, pick a plan that works for you, and just go enjoy your retirement. And the main takeaways are going to be that you're going to learn a little bit more about Medicare Advantage versus Medigap, which are also known as Medicare supplements. You'll learn how pre-existing conditions can matter in Medicare, and then you'll learn about some other issues related to Medicare, as well as the overall process for really what you are when making that Medicare transition. So of course we have to start with what is Medicare, and we like to oversimplify it, I guess, and just say it's health insurance. You know, you've had health insurance your whole life, whether it's through a job, whether you're self-employed and you just purchase it yourself. At the end of the day, Medicare is still health insurance. Yes, it's different. It's provided by the federal government, but like most health insurance, it's designed for healthcare inside the US, and it is also not intended to pay everything. You're still going to have deductibles. You might have copays. Some people think Medicare, once you get to 65, you're just covered in full and good to go. But unfortunately, that's not the case. And if you're 65 or older, disabled at any age, or you can see here on the right-hand side, some of the eligibility criteria. And the first part, I always like to say that Medicare, or original Medicare itself, is Part A and Part B. So when we talk about original Medicare, just think Part A and Part B. Now, that's not the only thing that you're going to have when you get on Medicare, but it's good to know at least Medicare Part A. That's generally hospital coverage. So we like to say it's room and board coverage. It will help with inpatient hospital stays, skilled nursing, home health care, just different Medicare inpatient related services. And you'll see a lot of the costs associated with it. So these are the out-of-pocket costs on the right-hand side. And these are somewhat important, but if you get a Medicare supplement plan or Medicare Advantage, these are all going to change. So don't dwell on this too much. But one thing to keep in mind, and I'm sure Melissa is happy to tell you this as well, Medicare does not cover long-term care. So if you do not have a plan for long-term care, even if you do, and you want to look at other options or just make sure it's the right one, keep in mind turning 65 and starting Medicare is not going to be that solution for long-term care. I don't know if Melissa, if you have anything for that or just for later.
No, I would just mention that we always assume in our financial plans that during retirement, there's a possibility or probability that you may have a long-term care event, or if you're with a spouse, then one of you will. And so we both factor that into our assumptions and then discuss your options. Long-term care insurance is very expensive, but also may make sense depending on your circumstances and preferences.
Yep, it can be expensive, but it's less expensive than not planning for it, as we all know.
I've never had someone who had it regret it,
there you go.
even if they were not using it in later years.
Absolutely. And now Part B of Medicare. So again, this is the other half, as you will, or for original Medicare. And Part B is the one that comes with a monthly premium. We'll talk about the pricing for Part B later on, but this is what you're going to actually pay to the federal government. It does by itself have an annual deductible of $203 if you do nothing else or if you don't get other coverage. And then this is the one that you've probably heard of as 80/20 coverage. So Medicare Part B, if you have outpatient medical services like you see here, then Medicare is going to cover 80% and you're responsible for the 20%. And there is no cap on that 20% coverage. And that's where a lot of those insurance products come into play. Again, if Medicare didn't have these out-of-pocket costs, then I wouldn't have a job and your mailbox would be a lot less full of junk. So Medicare will not cover the following, and this isn't everything, but it's a good thing to talk about what Medicare does and doesn't cover, so you're not too surprised. It won't cover routine dental. So if you're just getting fillings, crowns, anything it's very limited on what Medicare actually would cover for dental. It also doesn't cover routine vision. So if you're getting eye exams or just glasses, that's most likely not going to be covered by Medicare. If you do have some medically related vision problems like glaucoma or cataracts, that's a little bit different. And then Medicare itself doesn't cover prescriptions, gym memberships, or hearing loss for the most part. So of course, we've already kind of alluded to this, but it's really important to figure out where to go for advice. Everyone loves their friends, but their situation is totally different than yours when it comes to health insurance. I know I have tons of clients where they just, you sit around and you talk about health insurance because that's what you do when you turn 65, and everyone figures out, well, what are you doing? What are you doing? But if they're not looking at your medications, your doctors, whatever it may be, it's hard to go to friends or family when it comes to health insurance advice. Even doctors, the government, really anybody on here. Melissa was kind enough to bring us in to help alleviate some of the confusion, but all these people, I would tend to stick away or stay away from that as far as advice. So if you're eligible for Medicare, then you're going to have to figure out what are you going to do most likely at age 65. So part of the transition to Medicare is really just figuring out, do you even need to transition? And these are questions, if you want to remember these, to just ask yourself as you approach age 65. You might want to see if you're eligible for retiree coverage. I know that's far and few between, it seems like now. I just saw a news release or something about the state of Ohio, and they're getting rid of a lot of retirees coverage for health insurance. So if that is a option for you, just keep in mind the retiree coverage is important to compare your options. You'll want to figure out if you're actively employed, how big your employer is can also have an impact. And then you can see everything else on here that may impact what you do with Medicare. But if you do need Medicare, or if one thing that will also help you figure out if you need Medicare are some of these situations. You can see we kind of just made it easier and put whether you always need it in these situations or almost always. So if you're turning 65 and you have Obamacare or marketplace coverage, Cobra, if your domestic partner is covering you, go get Medicare Part B. I'll say pretty much always. Obviously, we're not going to give out concrete advice with just a webinar. You always have to take a look at your current situation, but these are really good examples of when you'll almost always want to get Medicare. So everyone's favorite topic, of course, is how much does it cost? And I'm sure Melissa will have a little bit to say for part of this, but let's talk about, I think the most important thing here is going to be how income actually impacts Medicare. So a lot of people don't realize that the base rate for Medicare that you often see advertised or you see everywhere, it's $148.50. You can see that in the upper right column here. But a lot of people don't realize that your income can have a drastic impact on what you pay for Medicare. And if you notice at the top of this chart, it's actually your income from 2 years ago. So Medicare and Social Security, they're always going to look 2 years back when determining what you might pay for Medicare. And you can see it is different if you file joint taxes or individual taxes, and they're taking into account your modified adjusted gross income. And you'll see here, this is referred to as IRMA, which is the income related monthly adjustment amount, which is basically a fancy way of saying they're going to adjust your premiums if your income is higher. So definitely take a look at this if any of these numbers impact you as far as Medicare premiums.
I would just add, so I literally just got off the call with the CPA, and we were talking about the decisions that one of my clients should make, our mutual client should make, about how much they take out of a beneficiary IRA that they received. And all of your other decisions in retirement about where you take money and when impact this IRMA decision. So it's very complex when you think about where your money comes from. You often have more control over your income in some cases than you did when you were working, and everything just comes through on your paycheck. But if you're working with the right team of financial planners, they will be thinking about IRMA, educating you on IRMA, if it pertains to you, and being able to show you whether or not you would be subject to it. In our tax analysis reports, we actually, every year when we run a tax analyzer on tax returns, we show you where you're at relative to IRMA on that report. So it is a growing and increasingly important function of a financial planner to be thinking about that in conjunction with your other kind of distribution or withdrawal decisions.
Yeah, it's nice that we talk about it here because I hate to be the bearer of bad news. Since I have no impact on IRMA, I just have to tell you, hey, unfortunately, you might be paying more than you think. And it also does apply to Part D, which is drug coverage, as you can see here, as well as to Medicare Advantage plans if they have drug coverage. And then also keep in mind that it does have a 2-year look back period, but if you need any help trying to appeal IRMA, so if you, let's say you had a higher income in 2019, but now you're retired in 2021 and your income is drastically reduced or reduced to a lower level, you can actually appeal it. So that way it will bring it to your current amount. So don't worry about being penalized just because you had made more money and then you retired. But that's different than what Melissa was saying, where, if you're taking distributions, that could have a far greater impact.
Yeah, and you have Giardini Medicare has some great resources for you to be able to understand the appeal process, and it gets made up eventually if you don't appeal.
Yes, exactly. It's always a 2-year look back. So in 2022, they'll look at 2020, and it's always going. And here's just kind of a interesting chart, I guess. It's from the Board of Trustees of Medicare. All that matters to everyone on the webinar is it's just a projection of IRMA in the future. So this is how they all sat down. And when I say they all, it's just the board of who makes up Medicare, and they determined what they think IRMA might look like in the future. So there's a huge difference going forward just from in the next 8 years. You can see at the top end, an additional surcharge of 368 is projected, and now it's going all the way up to 561 potentially. So it's going to impact more people. It's going to get higher. Just keep in mind, as costs go up, it typically does shift to higher income. So I could only imagine that these projections will be correct. But they are estimates, so just take it with a grain of salt and see what actually happens. So once you're applying for Medicare, there's different enrollment periods. We don't have the one on here, which is AEP. That's the annual election period. That's the one I talked about, October 15th through December 7th. It is what a lot of people call open enrollment, but we tend not to do that. But we'll talk about different timing elections of when you can sign up for Medicare. So the first one is when you turn 65. You might have heard of this in some way, shape, or form. You think, okay, I know I have 3 months before, 3 months, something about 3 months around your birthday. That's your initial enrollment period. And that's when you can sign up for Medicare for the first time when you're eligible at age 65. So if you're trying to start Medicare, if you figured out you do want Medicare to start at age 65, then you're going to want to apply in the 3-month window before the month you turn 65, and your Medicare would begin the first day of the month you turn 65. And if any of that's confusing, you can always ask us after. This is just an easy little picture to refer to. And if you don't want to start Medicare at age 65 because you're working for a larger employer or something to that effect, then you can always delay Medicare Part B and use a special enrollment period later. So you let your IEP, that initial one, go, and then later on, you'll use this special enrollment period. So that way, let's say you're retiring at the end of this year, you could actually apply now and get your Part B to start, let's say January 1st, even if you are past age 65. And we can always help you with that. Again, it's part of the overall transition process. But something to keep in mind, we bring this up more with people that have financial planners, because you tend to have more HSAs come up more often, is what I'm trying to say. So if you have an HSA and you're on Medicare or you're looking to start Medicare, just know that if you delay your Medicare coverage and you apply at a later date, your Medicare Part A will actually backdate 6 months before your application date. So if that made no sense, you can at least look at this. This is from an actual person's Social Security account, and you're going to see here they applied at the top in May of 2021, and their Part A, it went all the way back to November of 2020. So this can have an impact on HSA contributions. So if any of you have an HSA and you're thinking about starting Medicare or just have more questions about it, let me know afterwards.
Yeah, and I would just mention HSA equals health savings account, and they're increasingly important and popular and used as an investment vehicle, but they do not play nicely with Medicare. So make sure that you disclose that and make plans around it when you are enrolling in Medicare.
Yep, absolutely. You can keep the HSA, but once you start Medicare, that's where the contributions get really tricky. So we'll help you with that if that applies to you. And then everything else we talked about, like I said, that's really what makes up original Medicare Part A and Part B. And then everyone really wants to know, well, what do I do after that? These are the two options that you have once you start Medicare. This is directly from the Medicare and You book that you might have seen. And you'll notice that you can either go on the left side here and add a Medigap plan to your Medicare, or you can do an alternative to Medicare, which is a Medicare Advantage plan, and sometimes known as Part C, but we just call it Medicare Advantage. And that's where you actually have a bundled alternative to Medicare, where a private insurance company would be the ones administering your Medicare. So you no longer are directly enrolled in original Medicare, and they would be in charge of most of your coverage. So with that being said, here's just getting into it, some of the differences in the cost. These are examples, so don't take this to heart too much as far as pricing goes. But in the middle, you see that Medigap tends to have a higher premium and lower out-of-pocket costs, whereas Medicare Advantage will have a lower premium and some higher out-of-pocket costs should you need to use specific services. There's really not a right or wrong answer for which one to go with, but we always tell people, if you're going to start Medicare, it's your one chance where you can choose either path. You can choose the Medigap or the Medicare Advantage with very little restrictions. So just make sure if you're starting Medicare that this is your chance to figure out which way you want to go. And if you're already on Medicare right now and you're watching this webinar in the annual election period, just know that it's not open, like I said. So it's not open enrollment where you can just switch from one or the other with no health questions or no issues. So it is important to look at this when you first start Medicare. And of course, that's what we can help you with.
You may be going into this, but what would
Yeah.
the considerations be for why one would be better than the other?
We'll go a little bit in the pros and cons, and I can always, Melissa, you can ask me that afterwards if I don't cover it, and then in the
Great.
Q&A.
And for anybody that has questions, instead of raising your hand, if you can just type in your questions, then we will answer them.
Oh yeah,
that would be great.
Yeah, we try to just do questions after. I should have said that just because it gets distracting after going off the rails with it. But just know that Medigap plans and Medicare Advantage, either route you go, they are going to be provided by private insurance companies. So again, that's really where our role comes in, and we look at all the options in your zip code or area, and we try to see which private insurance company would fit whatever route you decide to go. And this is important. This is from the choosing a Medigap policy. This is another CMS, which is basically Medicare's booklet. And they say that the best time to buy a Medigap policy is the first 6 months that begin when you're 65 or older and enrolled in Part B. So it's not when you turn 65, but it's basically the first 6 months where you start Medicare Part B. That's the best time. That's when you have Medigap open enrollment, and you can get any Medigap policy with no health questions or no medical underwriting. So just keep that in mind when you're first looking at options. And I always just say, think about what you can do as a 75-year-old and 85-year-old. What do you want your coverage to look like going forward? Not just when you're 65. Health changes, needs change. So just think, what am I comfortable with for the long run for the most part? And this is a little bit what Melissa was saying. So Medigap, just generally speaking, if you want a little bit more control, if you want to be able to see any provider that does take original Medicare, this is going to allow you to do that. Medicare is still your primary coverage, and Medigap is just your secondary coverage. And then it does help you with budgeting a little bit. It does have a higher premium, but you know you have pretty fixed out-of-pocket expenses when it comes to medical treatments. And then, of course, in Michigan, being a snowbird is pretty popular. You know, you want to get out, go to Florida in February. This will make it a little bit easier to go back and forth. And you just have to be okay with higher monthly premiums. So if you don't want to pay more for the Medigap, then obviously it may not be the right solution for you, but it's just important to see when it may or may not make sense. Medicare Advantage is somewhat of the opposite. So it's more affordable on the front end with premiums. It's really good for people under 65. So if you're on disability, Medigap premiums are much higher. So that's where Medicare Advantage can come into play. If you're a military veteran, it's a great resource for you as well. And you just have to be okay with some of the restrictions, knowing that the insurance company is your primary insurer, meaning that you would want to stick with their network of doctors and hospitals, and you just have to understand some of those restrictions. And I'll just pause here. If it doesn't apply to you, if it does apply to anyone, I should say, let us know and we can help them. If they're a military veteran, they have different options than most people because they can use the VA alongside Medicare. So we always bring this up and just try to see if anyone is a veteran that there are special considerations. So the donut hole is another part of Medicare. We throw this in here mostly because everyone always wonders about it. The donut hole, if you've ever heard of it, is really just a time period where you might have to spend more out of pocket for prescription drug coverage. It's not something I'd worry too much about in depth. So we just want to show you that the donut hole does apply to prescription drug coverage. If you have any specific questions on it, please let me know. But I don't want to get off topic here and focus on something that it only impacts you if you have really expensive medications. And of course, if that applies to you, we can help you out with it. And then, of course, if you're sitting here and thinking, well, I don't care about the donut hole, I don't take prescriptions, then why do I even need Part D? Well, you may be familiar with the fact that there is a penalty if you don't enroll in Part D when you're eligible. And then it also, if you get diagnosed with something, you never know what's going to happen mid-year where you may need a more expensive medication. And or if you're on this webinar and you do have Part D and you're not checking your plan, please be aware that every year these plans can change. It's important to check your Part D and prescription drug options. Only about 10% of people actually end up checking or changing their plans. It seems kind of low compared to how many people actually should be looking at it. I will say I was going to wait for the end for this, but if you're not a Medigap client of ours, we can't unfortunately help you with Part D this time of year. So if you just need help with the prescriptions, we can show you how to look up your own. But unfortunately, we just have so many things to get through that we can't help you just check your Part D. So I wanted to at least get that disclaimer out of the way here. But this is the time of year to make a change. I know Melissa had talked about it. October 15th through December 7th, that is the annual election period. And that is when you can make a change in your Medicare Advantage or prescription drug plans. And the change will become effective January 1st. Now, Medigap plans, if you do have a Medigap plan and you're looking to change, you can actually do that anytime throughout the year, as long as you are healthy enough to qualify for a new Medigap plan. That's why we talked about Medigap open enrollment being so unique, because health questions don't come into play. So we'll kind of start wrapping this up. I know it's pretty quick. It's not as in depth. So that way you can always ask questions if you have any more detailed questions for us. But really, when you come out of this, just understand that there's different types of Medicare coverage options. It comes down to Medicare Advantage or Medigap, and there's plenty of options out there. Like I said, plenty of insurance companies are offering all these. So you do want to start pretty early when it comes to turning 65, even if you plan on working. No matter what your situation is, when you're about 6 months out from turning 65, just make it a point to at least look at options. Just compare your employer coverage. Ask yourself, is it you and a spouse? There's a lot of different factors that go into deciding whether or not you need Medicare. So start slightly early. You'll notice that the mail is going to start anyways at 64 and a half. Everyone's trying to knock on your door and give you a call. So just take a moment and sit down and look at your Medicare options. That's really the best time to contemplate your transition to Medicare. And then that's really it as far as the content. So we can do Q&A, and then I think Melissa will get to this, but after we'll talk about email addresses, so you can send me an email directly if you have a question.
So I know we have one question, and I think you may have answered it as you started to talk about the Medigap plans.
Yeah, I can see. Let's see.
Are there options other than the original Medicare or the Advantage PPO? What are additional options?
So if you have original Medicare and you keep original Medicare, you're most likely going to want to add a Medicare supplement policy or a Medigap policy to it. So you'd still have original Medicare, but that is an option to supplement that coverage. So you're not just paying 20% out of pocket, and you'd also get a Part D drug plan in that case. And then on the other hand, there are Medicare Advantage plans that are PPOs or HMOs. So if you want more savings, sometimes an HMO can be a good option, or a PPO if you like Medicare Advantage or the idea of it, but you still want to have a little bit more flexibility.
Great. Feel free to type your questions in into the Q&A. I had a couple questions just while we're waiting to see if anybody else has questions. One of them is, I know a couple years ago, it was popular to have Part F, and you mentioned Part G. Are there still some people with Part F? And if so, can they do anything to change it?
Yeah, so it's Plan F, but
Plan
I'm
F,
just saying
sorry,
that's
pardon
okay.
me. Thank
That's
you.
okay. It happens all the time. So
This
it's,
is
and the
why I
reason
talk to you and don't give the advice myself.
and the only reason I sound like a snob trying to correct you is just because part is kind of like a part of Medicare. So I don't want people to think it's, Part A or Part B, but it's Plan F is what Melissa was talking about. And that was the full coverage option. It was the highest amount of coverage you could get with Medigap. However, what happened with it is it was January 1st, 2020, anyone newly eligible for Medicare can no longer get Plan F. And when I say newly eligible, I basically mean anyone that turned 65 after January 1st, 2020. So people can still have Plan F, but if you want to look at other options and you're healthy enough to get to a different Medigap plan or like a Plan G, you can always do that to see if you can save on premiums. But as of now, at least going forward, Plan G is kind of the new gold standard of the most coverage you're going to get from Medigap. So hopefully that makes sense.
And I know sometimes people say, oh, I'm healthy, so
Yeah.
I'd like to pay the least premium. What are some of the kind of impacts you've seen if health circumstances changed, or what are how would you educate people to make that decision?
Yeah, I kind of mentioned it with just thinking about the future. And the reason I bring that up is because if you're in a Medicare Advantage plan at the beginning, and then you want to change, let's say circumstances change, your health changes a few years down the road, and then you come to me, even during the fall, even during the annual election period, and you say, hey, it's really time I think we look at a Medigap plan because I've got, heart issue, whatever it might be, you're not guaranteed to get a Medigap plan in the future in that circumstance. You can change to a different Medicare Advantage plan, but it's not like you can just switch whenever you'd like to essentially upgrade that coverage on the medical side to a Medigap plan. But if you have a Medigap plan, so when you first start out, if you look at it and you say, okay, this is my open enrollment for Medigap, I'm just starting Medicare, I want to get a plan just for whatever happens in the future. If that happens, you're not going to lose your Medigap plan if you get unhealthy. So it's a big difference trying to get one in the future versus having one and then keeping it. And I don't want to fear monger and say it's impossible to change. If you have high cholesterol or high blood pressure, any normal ailment, it's not going to stop you from getting Medigap. But if you have a cancer diagnosis or chronic conditions, that's really where it becomes more difficult to switch.
That's why I like working with you, because it is not fear mongering and you're not assuming one way or the other. Does the government or insurance companies give incentives to one plan versus another?
That's a loaded question, right? So as far as everyone always asks us, because a lot of times Medicare Advantage is lower premium and Medigap is higher premium, a big question is always, well, which one do you get paid more for? I can tell you it really is negligible at the end of the day. Medicare Advantage, they have a pretty high commission right away, but that tends to drop off. Medigap, over the long run, it tends to be the same. Now, the federal government does directly fund Medicare Advantage plans. So the reason they can offer so many benefits at such a low price is because the government is paying the insurance company directly, usually to the tune of north of $1,000 a month to administer your Medicare. So it's not that they're biased or favoring Medicare Advantage, but they are directly funding it, and it's something to take the risk off of original Medicare. So I don't know. That's kind of my cop-out answer.
Another question, where do I find information on different Medigap policies, coverages, and premiums?
You can try to find it on medicare.gov. Truthfully, if you just email us, we're going to be much better equipped to give you that information. There's probably 40 or 50 different Medigap plans in a given zip code, and they make it very difficult for consumers to find that information. So if you want to give us a call or email us, I can either send you a list or just talk to you about the options.
So that would be a useful, I'd love, I'm comfortable with you giving a plug to say how you work with people and what kind of advice you give.
Yeah. So when we work with people, we do it virtually, like I said. So we do a lot of phone calls, and we just take into account everything you're looking for, whether it's, you want more benefits, you're just looking at Medigap options, whatever it is. If you're starting Medicare, that's, like I said, where we work best to help you decipher the Medicare transition. And then we go from there and figure out, okay, if you want Medicare Advantage, what's a good option? If you want Medigap, what's a good option with that route? It's really just as simple as talking to us, and we can help you find a plan. And like I said, even if you just email me and say, hey, what are a list of Medigap plans in my area, I can give you a list that's going to be better than anything you can find online. That way you're not putting your number in somewhere and getting hounded.
What's the biggest piece of misinformation that people hear from their friends or make assumptions on that you'd like to clear up?
I would say just that nothing's perfect by any means. Medigap's not perfect. Medicare Advantage is far from perfect. You'll have a lot of people that say, well, I have this plan. It costs nothing. I pay nothing. Nothing ever goes wrong. Well, do you ever use the doctor? What are you actually doing on the back end? And other people that will say it's just, you have to expect that if your medications are expensive, it's not going to be the same as somebody else. If you have different doctors, if you travel, you just have to understand that every situation is unique. Otherwise, my job would be pointless and we'd all put you in the same coverage. So I think that's the biggest thing.
And I see the information outside of Medicare about how people spend on healthcare. It's shocking how much you could spend on dental work, for example. And sometimes you want choice, and you may not be looking for all of your doctors to be kind of in the sweet spot of Medicare coverages. So in our planning assumptions, like I said before, we do always assume that you have out-of-pocket costs that go to your healthcare, and that those costs are inflating higher than your typical other costs in retirement. In fact, healthcare costs are one of the biggest, one of the few things that goes higher every year, typically for the average American. So integrating both your Medicare decisions as well as your decisions on how you withdraw funds and how you prepared for retirement, that health savings account is a prime example of something that can help to fund those out-of-pocket costs that are going to get you over time. That's a big deal, something that it's really important for you to remember. So don't
you just have to
make
make
the decision.
sacrifices in certain situations too. I mean, it's like investing, right? If you're 65 about to retire, you probably shouldn't have 100% Bitcoin in your portfolio. So you just want to understand that every strategy comes with sacrifices or risks. So everyone always comes to me, they want the lowest premium, the most benefits, gym memberships, everything, right? You have to make trade-offs for one or the other. So just keep that in mind.
Well, I appreciate that information. I don't see any other questions, but we also, if you can forward
through.
Yeah, why don't you forward?
Here's our website, Giardini, or it's gmedicareteam.com. You can email us at info@gmedicareteam. Probably should have had this up, but here's our phone number. We do have YouTube videos that are really helpful. If you just type in Giardini Medicare on YouTube, you'll get a lot more in-depth information than even this webinar. As you can see here, a lot of it's me. So if you don't like me, I probably wouldn't check it out. If you can tolerate me, it's a good place to go. And we also have a podcast. So Transition to Medicare podcast, and I'll get to Melissa. So.
Well, we appreciate everyone that's attended. We have some upcoming presentations. Also, this month, we'll also be doing a presentation on the impending or proposed tax laws, which may or may not be in effect prior to the end of the year, as well as the investment environment. You can find that on our website at pearlplan.com under the events section. And if you have follow-up questions, feel free to reach out to anyone on our team, especially myself, Melissa Friedenberg, or Alexa Kane, or call our office. And if you go forward one more slide, if you don't mind, Cameron. Also, we additionally have a podcast. Cameron's been a past guest, and it's called 52 Pearls Weekly Money Wisdom. Finally available on Apple Podcasts, in addition to Spotify, where it has always been.
Nice.
So I don't see any additional questions, but this conversation will be available in a replay format. We'll send it to everyone who attended, and we will also have it in upcoming newsletters. So subscribe to our newsletter if you would like to continue to receive invitations for events like this, if you're not already a subscriber. And if you know someone who would benefit from the information that we provided, don't hesitate to look on our website or forward the video that we'll provide so that they can have the information they need as well. And as always, just like Cameron said, This is general information, and all the advice that Cameron and I give is personalized. So use this as education, but also get specific advice to your circumstances when you consider your own personal decisions. Cameron, thanks a lot for joining us today.
Yeah, thank you for having me. I appreciate it.
Appreciate it.